Hi, Dr. Scott Jensen here with Dr. Jackie Connolly. And yes, she's my daughter. She definitely got a lot of her genes from her mom. I want to talk a little bit today, Jackie, about hope and balancing it with honesty, because a lot of times that's one of the big challenges when I'm working with med students or residents is how do you absolutely be honest with the patient and yet still provide that very necessary infrastructure of hope. I mean, if we're going to tell someone that they're going to have a chronic diagnosis, whether it's diabetes or MS for the rest of their lives, or a cancer, we want to be truthful. We have to be. We can't afford to break the trust. And yet, we know that hope is going to be such a powerful part of them moving forward and potentially even enhancing their ability to live with what they have.
Yeah.
Those are tough challenges for young doctors because they're not exactly certain. How do you enter into that kind of a discussion? What are your thoughts?
Yeah, you hit the nail on the head there. The key word is trust. The key word is trust. If you have built a relationship with a patient and they know you and they trust you and you've led them down a good path so far and helped them, then when you have to have that conversation where you say, hey, this is what we're going to be dealing with, they trust you when you say, but we still have hope. This is not the end of the world. We can fight. We can do this. We can do this. We can do this. And I will be here every step of the way. And I think that trust that you've built with them, and then the knowledge that you really will be there. You know, you'll answer their phone calls. You'll be there when they, need just a little bit of reassurance or a little bit of a boost. I think that's what's important.
It's a really good point. When we tell them, we are going to be at your side.
Yep.
We're going to walk alongside of you. That's huge. How do you feel about miracles? I mean, for me, I tell my patients that oftentimes what we think we know in medicine, where we think we've got it all covered, that sometimes you could fit what we know into a thimble. And that I have seen patients recover miraculously when, frankly, they were supposed to be at death's doorstep. I've seen it over and over again, but I'm a titch older than you. So what are your views on those tiny everyday miracles? How do you incorporate that into your discussion?
I think miracles happen. They happen every day. Yes, I haven't seen as many as you, but just in little ways where someone comes in for a pre-op for an elective surgery and they hurt their foot, they need a surgery, and they have to get blood work done, and all of a sudden you catch an early leukemia. That happens. That's happened. I can think of 2 patients in the last several months that's happened, and that's a miracle. They broke their foot, and then we discovered leukemia, and we were able to intervene.
Yeah. So hope is connected with honesty in a balanced kind of fashion, and miracles enter in, and walking by the side of the patient is perhaps one of the most critical things we can do.
Absolutely.
Thank you, Jackie.
Thanks.